Okay, now here's a different situation. You have a baby that's laying in the crib. The face is blue, you're not sure what's going on. They don't seem to be awake, and their chest doesn't seem to be going up and down. So how do we start this off? Same way as we always do. How do we start this off? You're going to flick the baby's feet. Flick their feet, and yell in their face. Baby, baby, wake up, wake up, wake up, wake up. Now, if the baby doesn't wake up, what do you do next? Now, if there's somebody there, you can tell them to call 911 immediately. But if you're by yourself with a baby, what you can do is what? Just go ahead and start with the ABCs. So the first step of the ABCs is going to be opening up the airway. We open up the airway. Once we've opened up the airway, next what do? We check for breathing. I'm going to check for breathing, looking at the chest rising and falling, listening and feeling for air. There's no breathing after 5 seconds. Now, if there's no breathing after 5 seconds, what do? I put my mouth over the nose and the mouth, and I give how many breaths? 2. Everybody gets 2 breaths in the beginning. I've given the 2 breaths. Now what do? I check for the pulse. Where do I check for the pulse? Brachial artery, inside of the upper arm, right here. So I'm going to feel on the inside of the upper arm. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Of course, you're going to do this on the baby's arm, not on your own arm. Now, let's say there is no pulse. There was no breathing, and now there's no pulse. What do? We have to do compressions. Now, on a baby, generally, we're going to give the same as an adult or a child, which is 30 compressions and 2 breaths. But let's say that this is a newborn. If we have a newborn baby, just a couple of weeks old, we're going to do a little different. We're going to do 5 compressions and 2 breaths. So 5 compressions and 2 breaths. Okay? You can also do 5 and 1. A lot of people remember the 5 and 1, so we can just stick with the actual 5 and 1. So 2 fingers in the middle of the chest right here, kind of like what we did with the chest thrust. Same thing. So 2 fingers in the middle of the chest. You're going to tuck the baby in just like this, and it's going to be like this. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Now, it's generally about 20 cycles, but you're not expected to remember how many times to count. We do this for about how long? A minute. And after about a minute, what do we do then? A, B, and C. You get back down there, and you recheck the ABCs to find out what exactly is going on. That's what you do for infant CPR if there's no breathing and there's no pulse.